Hello everyone, welcome to an episode of TooHealthTalk. We'll get to talk about real health challenges in a very simple and honest conversation. On this episode, we have a pharmacist with us today where we're going to talk about drugs and how we consume drugs here in Nigeria and Africa at large. But before we continue, please, if for you to support what we're doing here, I'll be pleading for you to subscribe, like, and share this video. This is the only way to support what we're doing here, and make sure you watch to the end because you're going to learn a lot from today's show. Back to our guest. Our guest is a very special guest, the person of Zainab.
From Zainab
Oh,
Kabir.
welcome, ma.
Thank you so much. Thank you for having me.
Thank you so much. We are busy schedule. Like I should be thanking you more. We're busy schedule able to make it here to our show to enlighten our viewers.
I'm an advocate of health talk,
Oh,
really,
okay.
public health. So I love, sharing what I know, sharing how things are supposed to be done from my own little experience. So yes, I'm happy being here.
Thank you very much. So today we're going to be raising awareness and we're going to be talking about something that gets to affect almost everyone. I think even me, I get to do that sometimes a lot, which is over-the-counter drugs, OTC. So like, what's the difference between OTC and proper prescription?
Okay, OTC medications or OTC drugs, like you mentioned, over-the-counter medications. They are often medications that anyone can get without a doctor's prescription. Yes, you can just walk into a pharmacy and then you just, tell them what you want and they can give you without requesting for a prescription. While prescription medication, as the name implies, prescription, you have to come with, a well-written doctor's prescription before you'll be able to get the medication. So that's the difference between the two.
So like, but why is it common? Do you know why it's very common in Nigeria where people just go to chemists, go to the pharmacy to get drugs without prescription?
Hmm. If we could talk about this, we can spend the entire day talking about this because it's a very broad, talk. But I will cut it short. People often go for accessibility and affordability. Accessibility in the sense that over-the-counter drugs are easily accessible, and then it's more affordable for people to just go into a pharmacy and buy medication rather than go to a hospital where they will have to pay for a lot of things. So it's easily affordable and it's easily accessible.
Oh, so I know most of these drugs are mainly you get Panadol, you get painkillers. Is there a risk factor to this medication, mostly painkillers and Panadol?
Yes. The prolonged use of painkillers can cause a lot of issues, especially Panadol, like you said. Panadol, people don't understand that taking Panadol for a very long time can cause liver damage.
Wow.
Yes. And taking painkillers like ibuprofen and diclofenac and all sorts of those NSAIDs can cause ulcer, bleeding, and even kidney damage at a point.
Wow.
Yes.
So those like most people take these painkillers. For example, now women take painkillers when they are seeing their period. It gets some of them say it gets to help them. Is it like any other medication that is not painkiller that you prescribe if it's not painkiller for period pain?
So normally, period pain is not supposed to be that painful that you have to take very strong painkillers. If any person, any lady experiencing a very hefty pain during her period, I think she should better see a gynecologist rather than taking, over-the-counter medications. So, and then the question you asked, you can take Panadol, or you can take mild painkillers to subsidize pain, or probably you can even go for home remedies because I personally prefer home remedies during that period.
What are the home remedies?
Ginger, turmeric, even hot water flask perform magic during those kind of phases. And if it's monthly, it's okay. At least you won't say you take it every day. It's not a prolonged use. If it's monthly, it's not a prolonged use. You can take it if it's unbearable. But like I said, if any pain is unbearable, it's better seek a proper medical care.
Oh, is there any like right now in Nigeria? Is there anything put in place to stop over-the-counter drugs?
Well, NAFDAC are really trying. They're the ones responsible for regulating, over-the-counter medication or selling of fake or substandard medications in all. But the enforcement is very weak. So I feel they are trying, but they need to put more effort.
Or do you think that there is any specific OTC that is commonly used in Nigeria?
Yes, a lot of them. Like you
Like which one?
said, paracetamol, ibuprofen, cough syrup.
Cough syrup.
Exactly.
Wow.
Yes. And then, even Gestede, they are frequently, even antibiotics and anti-malaria. Any small thing, you need to go and take antibiotics. I need to take anti-malaria. All those medications are.
Oh. So, like, what of the excessive use of, like antibiotics now? I had when you get to use antibiotics a lot, you won't get to react to those, like your immune system won't get to react to those antibiotics again.
Yes, that's what we call resistance. When you
Oh,
take them
oh,
for a very long time, it causes resistance, or you don't take them properly. Long use of antibiotics and improper use of antibiotics can cause resistance. The bacteria will get, used to that medication and it will be to become less effective. It will become practically useless when you take them.
oh.
Yes.
So now, is there any for you now as a pharmacist now? Like, is there any awareness you are raising, like personally, apart from being on the show? Because I know you're raising awareness now. You've been on the show,
Yes.
like maybe someone comes to get over the counter drugs. Did you stop them and say, "Oh, where's the prescription?" Or you just sell?
In Nigeria, it's more like a tradition for a person to just walk into, a patent pharmacy store to just tell you, I need this, I need that. And as a pharmacist, the more you try to explain it to them, the more they get confused. Some patients don't even want to listen to you, just want you to give them what you want, either because they are paying for it. But, in a hospital setting, a hospital pharmacy, patient can just walk in to get a medication without passing through, the doctor before coming to the pharmacy. So at least that one is understandable. But in pharmacies like a community pharmacy, they just walk in and just get the medication and that's it.
So who should be held responsible for this issue?
Well, I would say the pharmacy owners, yes, and the patient as well. The patient should be held responsible as well because they didn't seek proper guidelines. They didn't seek proper, guidelines on how to go about everything. You can't just walk into a pharmacy to get medication without knowing what you're even treating yourself for. It might be something deeper than that.
Wow.
Yeah.
So like, what's your general overview now? What's your general advice now to the public about OCT? Sorry, OTC.
OTC, yes,
Yeah.
over the counter medications. Well, I would say every pill you take carries a decision, either to heal or to harm. Over-the-counter medications can be harmless, can be easily, accessible, but at the same time, easy comes with education as well. So I would advise Nigerians, they have to move from getting to survive the illness to getting to know the illness before taking a pill.
Wow.
Yeah.
So you're talking generally now, even if I'm having headache and like, oh, I have to see a doctor for a doctor to give me a prescription if I get take Panadol.
Having a headache might come with, much deeper things than you think. A lot of illnesses can start with headache. You might not know what you're treating yourself for. You might have, should I say, you might be having malaria and you won't even know it's malaria, and then you go and take paracetamol or you will go and take Panadol without treating that malaria, and you won't know you have malaria until you go to the hospital and run the malaria test.
Oh, so
Yeah.
over the counter drugs and taking these drugs at home. are not advisable? You must see the doctor to get prescription before you get to take this drug.
Advisably, get a proper medical guideline before taking any medication. Advisably. They might be easily accessible, like I said, but it might be something deeper.
Oh. Okay, thank you so much for coming on the show. Like, I really appreciate you coming on the show, and raising this awareness of over-the-counter drugs is going to help every one of us, because you might be taking, like you said, now, you'll be taking Panadol, and it's going to damage your kidney or your liver
Exactly.
in the long run.
In the
So,
long run.
yeah, so I believe a lot of Nigerians should be able to know this. That
Exactly. And even taking, as you're having headache, like I said, when you go to take paracetamol without, consulting any medical professional, like you said, it might damage the kidney. And at the long run, you might not be able to treat that illness you're having because you're not doing the proper thing you need to do. So it's like a waste of money. You waste your money to buy the paracetamol, and then you waste your time, and then at the end of the day, you didn't achieve what you're looking for.
oh, okay. I think that's a wrap up about OTC. Now, you're the first pharmacist I'm bringing on my show.
Oh,
Yeah,
okay, that's a privilege.
so, like, I really want to ask, this is a personal question. What's it like being a pharmacist? And you guys are drug dealers too, so.
As you can call us that. Well, being a pharmacist is one of the most, should I say, um, I don't want to say like a beautiful feeling. There's this feeling of being satisfied when you actually converse with patients about what they are taking, consult with them, and then achieve, for the patient to achieve the therapeutic effect. It's like you hit, a nail where it's supposed to be heated. So it's a fulfilling profession. I feel fulfilled
Being a pharmacist.
being a pharmacist.
Were you growing up? You already know like you're going to be a pharmacist.
No, funny enough, I really never thought I was going to be a pharmacist.
Oh.
But I know I have keen interest on medical line.
So, what was your first choice of interest?
Do you really need to talk about that?
Okay, so just give your maybe your advice to maybe someone that wants to go into being a pharmacist, or
They should go. Pharmacy is beautiful, is fulfilling, is less time consuming, like medical doctors, and your umbilical cord is not buried in the hospital like doctors. You have lots of branches you can venture in. We have the community practice, we have the industrial pharmacist, we have the hospital pharmacist if you want to work in the hospital. We have a lot of branches, and if you know what you're doing, you'll thrive well in the path you take.
so now you just compared pharmacists and doctors. That so pharmacy has a lot of free time to themselves than doctors.
My dear, they do. There's a lot of flexible timing. You choose like, I'm very sure you run calls here, right?
Yeah.
You run calls, 24 hours calls. Yeah, in some hospital pharmacies run 24 hours calls as well, but it's not as busy as the way doctors do. You need to be like going back and forth from here, attending to a lot of emergency. The advantage is you staying in a place, the patient coming over to get the medication, you'll be comfortable, your patient will be comfortable as well. You get time to converse with your patient, and then you dispense what you're dispensing, and the patient goes while you're still sitting down. Do you understand?
Yeah.
But as a medical doctor, I don't think after consultation in the consultation room, you have to go and go around, go for ward round, go for other things. But I'm not comparing. I'm not saying this is better or this is not. I'm just saying there's a lot of flexibility, like I said, than being a medical doctor.
Okay, thank you so much, Doctor, once again for coming on the show. And on this point, we call it a wrap. Like I said earlier, please, if you want to know what we're doing here, please like, share, and subscribe. And if you have any other questions for Dr. Zina, for Farm Zina, you can drop it in the comment section and she'll get that answer.
Right.
Thank you once again. See you in the next episode. Bye.
Thank you for
Bye.
having me.